Number 1, supine. Number 1, 2, upper extremity reaching for self-exploration with the hands and the elongation of the shoulder girdle muscles. Upper extremity reaching. The therapist places both hands laterally on the baby's trunk and pelvis, then applies downward traction while lifting the baby's pelvis slightly to place it against the therapist's body. The therapist places the fingers of both hands on the baby's scapulae, thumb lightly on the baby's humerus, maintaining gentle pressure, and the therapist slowly abducts the baby's scapula and horizontally abducts the baby's arm. Hands to arms. Maintain constant pressure, then the therapist slides his hands around the baby's shoulder and onto the baby's humerus, gently abducting the baby's left arm onto the baby's chest. The therapist slides his hands and along the baby's right arm with gentle traction until the baby's left hand reaches right arm. The baby's shoulder elevates, the neck hyperextends, and the mouth opens during the facilitation. To counter elevation of the shoulders and hyperextension of the neck, the therapist uses index finger to depress the baby's shoulder gently during the facilitation. The therapist maintains the shoulder girdle depression while abducting the baby's arm across the chest so that the baby's hand reaches the opposite arm. Hands to face and mouth. The therapist uses his fingers to maintain the baby's bilateral shoulder girdle depression and humeral adduction, while using the thumb to guide the baby's elbow into flexion so that the baby's hands come toward his face. Continuing to maintain the baby's opposite arm in adduction with the ulnar side of his other hand, the therapist uses his thumb and the index finger to supinate the baby's forearm, opens the baby's hand and reaches that hand to the opposite side of the baby's face. The baby's thumb ultimately goes into the baby's mouth. Hand to hand. The therapist continues to maintain the baby's humerus in adduction, sliding his hands down to the baby's forearm and bringing the baby's hands together while encouraging the baby to look at the hands. Hands to head. While holding the baby's forearm, the therapist gently flexes the baby's shoulder so that the baby can reach the hands to the top of the head. Precautions. Number 1, don't flex the thoracic spine while elevating the baby's pelvis. Number 2, maintaining the elevation of the pelvis. Number 3, abduct the baby's scapula first. Number 4, don't pull the arms. Number 5, if the baby resists the movement, reduce your pressure. Number 6, don't put the baby's hand in the mouth if the baby has a bite reflex. Number 7, place your hand over the baby's hair if the baby has a grasp reflex. Component goals: elongation of the spinal extensors, activation of head, neck, and trunk flexors, elongation of scapular adductors and elevators, elongation of humeral extensors, activation of humeral flexors and horizontal adductors, elongation of elbow flexors and forearm pronators, activation of elbow extensors and forearm supinators, hand on body play to decrease finger fisting and grasp reflex and increase active grasp with various shapes. Functional goals: number 1, reaching of hands to various body parts for body awareness and body exploration. Number 2, increase range of motion in shoulder girdles and upper extremities for all reaching patterns.